Good evening, everyone. This is Mr. Troy, of course. Wanted to give you some updates. I know you're wondering about content and about your evaluations, your EOLs. So let's talk about that. Um, had a few issues come up. So it's Tuesday, October the 20th, and you don't have your cardiac content yet. I've directed you to get into the book and look at a couple of things, which I will speak on cardiac content for just a second. But first, I'm going to talk to you about the schedule. So, everything is changing, multiple times this semester. And then I've had some issues come up uh, regarding Delta, regarding personal stuff, whatever. And we all have that going on. So it's hard sometimes to just figure out how to focus on what we're doing, but we've got to do that. So we wanted to make it as good a learning experience for you as possible. And Miss Pender and I are not interested in you doing the pump and dump thing, the learn and dump. We don't want you to just memorize a few things. We want you to understand the content and to be able to apply it. So we're talking about on ATI, on final exams, on NCLEX, and in the real world of nursing. So what can we do to help you to learn and grasp the content? One thing that we've tried to do is to give you things as far as your assignments and alternate evaluations that are going to enhance your learning, that they're not going to just be busy work. We understand that you've got a whole lot going on. You've got OB, you've got research in 321 and all that. So we've tried to make sure that what we are posting as far as workload is reasonable. So what we need to do at this point is get you some more content for these next items. But first, we wanted to say, okay, how can we do this as far as a schedule revision where we could make things as good as possible as far as learning experience. So what we have come up with is giving you a little bit more time for this next content. I'm going to just expand this just a little bit and look at where we are right now. October 19th. The content for this week is cardiac and emergency. As I've already told you, emergency, I will give you very specific parts of the chapter to look at. So you can continue to wait on that. You can glance through the emergency chapter, but until you get that direction of what exactly to look at, you may want to focus more on your cardiac. And I will talk to you again a little bit about that. But the alternate evaluation for chapter 14 and 15 has been posted. It's a prep you quiz for each of those chapters, and I think that everybody should have seen that by now. If you haven't, or if you're having trouble finding it, let me know. Mastery level of 3, it's got a due date for you, all that's been in place. Now, what we were going to do is have you do an EOL on cardiac and emergency here on October 26th. That's kind of a quick turnaround. And like I said, we want you to learn the material. So we've changed a few things. So instead, on October 26th, your content's going to be integumentary, hematology, and neoplastic. Sometime during that same week, you will have your alternate evaluation for those chapters. So this is a little bit different approach, but it's for your benefit. So the alternate evaluation, whatever that's going to be, whatever Ms. Pender decides on that, is going to be posted that week. You'll have what you're supposed to do, due dates, and all of that. Gives you an extra week before you have to do your EOL on cardiac and emergency. So you have some extra time to learn this material well enough to be able to apply it. Then the content for that week is nose and throat, and then we continue on this pattern for the next week's content, because instead of turning right around and having another EOL the very next week, we've done the same thing. So I'll teach you neurological and musculoskeletal, post an alternate evaluation for that, and then the next week you have your EOL number 3. This is the only time when we do a back-to-back week 1 to week 2, and the reason we did this is because if we tried to move things around at this point in the semester, it would get a little bit confusing for you. So I'll be speaking to you about how to really focus your efforts and focus your studying when we get to this point, and you're only going to have a week to grasp and apply the content for genitourinary and endocrine. So we will be talking with you more about that. So this is when you'll have your EOL on that, and so forth. So the new schedule is posted. It says revised again post Delta, and I want you to take a really close look at that and let us know if you see any issues. Schedules are subject to change. This is something we put at the on the schedule every semester, and sure have used it this semester. So let's go back up just for a second. I'm not going to pull up a PowerPoint right now. I will be posting lecture materials for you. But as you are looking through your textbook and as you're learning and as you're looking at the PowerPoints that I will post, I want you to realize that congenital heart defects are very common and can be life-threatening, can be a really serious issue with kids, or it could be something that just kind of resolves on its own. So we'll get into some of those. So to understand cardiac content for pediatrics, you really need to know a little bit about how the normal circulation works, how your circulatory system normally works as a person, as an adult, as a pediatric. You know, there are some differences as far as what your blood pressure is, but I'm just talking about your normal anatomy and physiology. Secondly, you need to know a little bit about how things change, how things are happening in the neonate, or the fetus actually, the unborn baby, the fetus, whatever you want to call it at this point. Just think about what's going on in the womb. And so in the womb, is the baby breathing? Is he breathing oxygen? Or is he getting oxygen to the tissues a different way? So obviously he's getting that from the mother. She's getting that from the mother. You know, you've got umbilical circulation there. And so in the womb, the lungs are basically collapsed. So they're a very high pressure system. There are some things that are open between the chambers of the heart. Take a look at all of that so that you can see how things change from fetal circulation to newborn circulation. And when that baby first cries and those lungs open up, how things change and begin to change. Some things change instantly, some things begin to change and take a few, you know, a little bit longer than that to completely close or completely change. But that is crucial to understand some of those changes, because when those changes don't happen correctly, when they don't happen as expected, then you have different congenital heart defects. Some of these have decreased blood flow to the lungs. Some of these have increased blood flow to the lungs. Some of them are considered cyanotic, and some are not so cyanotic. But to understand what's going on in the child, and the baby, or the toddler, or the child with congenital heart defects, you have to understand fetal circulation to newborn a little bit, so that you can understand what's not going just right, what's not happening, what's not closing, what's not going in the right flow, or what's having more pressure or less pressure than it should, so that you can understand, oh, well, that's why this kid is hunched over trying to breathe and can't breathe, and is squatting in the corner trying to breathe. What's causing him to do that? So that'll be all clarified, of course, when I post your content. But I just wanted to let you know that's the second thing you need to be looking at, is your fetal circulation to newborn, and then how, when that doesn't happen like it's supposed to, how that leads to congenital heart defects, and so that you can understand the manifestations of those heart defects. And understanding the manifestations, you can then understand, what do we do about it as a nurse. You're not trying to be a pediatric nurse practitioner right now, or a doctor or surgeon, so you probably won't have to learn about what little devices that they use in surgery and all the technical stuff during surgery. But what you do want to focus on is the nursing care. So then we will go from that congenital heart defects to talking about other things pertaining to the heart, such as heart failure and infective endocarditis and all of that stuff. So it's a complicated chapter, and that's why one of the reasons we wanted to give you some more time. But think about the fact that you're trying to learn how to be a generalist pediatric nurse, able to take care of these kids that have these heart issues, to be able to anticipate, to be able to understand something about what's going on in their body, and to be able to do the nursing interventions and make good decisions. You're not trying to be a surgeon, you're not trying to be a nurse practitioner at this point. So keep that in mind, and I will give you some examples of test questions that we've used in the past, or that may come from PrepU or ATI or somewhere, to help you kind of say, oh, well, that's how we're applying this content. So post those things as soon as possible. Really need to be thinking critically, and I'll try to help you get to that point. If you have any questions about the schedule and what the plan is, please contact us. Some of you I have your numbers or contact you different ways. If you email us and you need a call back, make sure to put your number, or text or whatever. Make sure to put your number in the email. If you're emailing us, know that it may take a day or so to get back with you. Sometimes I can get back with you very soon, and other times it may take a little bit longer. But if you need a more immediate response, be sure to let us know. Leave a phone number. I'll text. A lot of times text is a little bit quicker. And just make sure to review this schedule. So hopefully y'all have a good evening, and that clears up where we're going from here. Good night.